All right. Well, good afternoon, everyone. Thank you so much for taking the time to be with us here today. We're very excited for everyone to tune in to listen to our first launch of measuring safety this year. So this first launch of ours for measuring safety is the Regional Transportation Authority's Survivor Transportation Pilot Program. And we're excited to give some context on the background of the program, talk about all the amazing data that you all collected, and share, how the program has gone and our final recommendations. Okay, so our agenda for today, as I mentioned, we will be doing an introduction. We did our introduction. We're going to give some background on the pilot program, how the program came to be, and what the guidelines were. And then we're also going to be covering extensively data on the pilot program and sharing all of the feedback that we have. We're also going to be discussing alternative models to this existing pilot program, and some creativity around how to address this intersection of survivorship and transportation needs. And then we're going to end out our conversation with recommendations. So after a year of having had this pilot program, what is the networks and our participating members' recommendations on how we can improve and expand the program? What is the network? The network is a coalition of service providers that provide domestic violence, sexual assault, and sex human trafficking services throughout Chicago, Cook, and some Collier counties. We're able to reach survivors and programs through administrating the Illinois Domestic Violence Hotline, and we also serve our members through training and resources. We engage in systems legislative advocacy at the state and local level. And what is measuring safety? If it's your first time joining us for a Measuring Safety report, again, welcome. And it's a key component of our policy advocacy and research team. This is the second year that we've decided to serialize our reports. So each report has a specific topic that we focus in on. Today, obviously, we're here to talk about the intersection of transportation and survivorship and cover data around this pilot program. But really, these reports are used as a tool for advocacy and expanding public education and our reach. It's really used to look at what services are being received and where maybe our needs outmatch our resources. And just to be clear, measuring safety is not a scientific study. We don't claim any causal conclusions from any of our reports, but we know that they can be an absolute tool for anyone who's interested in accessing them. So who are our partners and what are our data sources for today's report? So our first partner was the Regional Transportation Authority, the RTA for an abbreviation, and they provided 25,000 $20 Ventra cards to the network, including PAN IDs, which is a unique identifier for each card, which is how we were able to collect all of this data by each card. We partnered with participating organizations that included domestic and sexual violence services that were located throughout RTA's region. So their service area included Cook, DuPage, Kane, Lake, McHenry, and Will counties. And we were able to coordinate with programs in those counties to provide these cards and coordinate. We provided each program that was participating a distribution log with individual PAN ID numbers. And that way we were able to access live spreadsheets, and so were the programs to report on how the cards were being used. And finally, we also used surveys. Providers responded to 3 surveys throughout the first year of the pilot program. And they provided those surveys to the network to give feedback on how the program was going and also provide survivor impact stories and testimonials on the program. We also want to give a big thank you to the service providers throughout the RT region for your patience, creativity, and diligence in lifting this pilot program off of the ground. This was the first kind of pilot program of its kind. So we were all kind of inventing and building up this program as we went. But we think after we cover the data in the report, we know that it was a big success, and we hope that it will continue to be a big success. So thank you for your collaboration and your work in filling out the surveys and filling out those distribution logs, because we're absolutely going to put them to use. And you can see that throughout today's report. And then thank you to the Regional Transportation Authority, the RTA, for their dedicated partnership in helping us facilitate this program, and really ensuring that survivors are able to access transportation in a meaningful way, and have as few barriers to access transportation as possible. Okay, so we're going to dive into a little bit of background on the intersection of transportation, of addressing the intersection of transportation and survivorship, and also a little bit on the background of the creation of the program. So first off, we want to start with what barriers to transportation for survivors looks like, and what we know from the research landscape here. We know that 94 to 99% of survivors are estimated to experience financial abuse as part of their experience of abuse. And transportation is one of the largest costs of any US household, and can absolutely be layered when a survivor is experiencing financial abuse. We also know that transportation interference is a form of control and abuse that a lot of survivors experience, and it can manifest in a variety of ways, including things like slashing tires or stealing keys, not allowing survivors to get a driver's license or renew a driver's license, monitoring where they're going and when they're going. So it's really important that as we set up the conversation for this report, we keep in mind that there are a lot of barriers that survivors face, and when it comes to transportation interference. We also know that in some regions of the country, surveyed survivors were less likely to own a car than the general population, limiting their options to transportation. And we'll talk about other models, but again, the pilot program was really looking at public transportation as a vehicle for mobility for survivors. And then there's also a large body of evidence that survivors living in rural communities may struggle with transportation more, and have issues accessing transportation more than survivors in other areas. And it's really important, again, to emphasize that inability to access transportation is a life-threatening barrier for survivors of domestic and sexual violence. Again, just a very kind of impactful visual that we have here of all of the ways that transportation barriers can impact survivors, everything from employment to school, childcare, daily needs, medical care, accessing the court system, law enforcement, or even accessing support networks, if that means, they have friends or family that live in another part of the state and they need support getting there in order to leave that abusive relationship. It's really important, and it's really important as we have this conversation, again, to think about access to transportation as accessing safety. And to put it simply, without transportation and that mobility piece, it is very difficult for survivors to leave an abusive relationship. Pilot program background. How did we end up with this pilot program? So first, we recognize the importance of addressing transportation access for survivors. And so we advocated for the creation of this pilot program. And in the spring of 2023, in the Illinois General Assembly, they passed a transportation package, which included the creation of this pilot program. And we want to give a very special shout out to our two sponsors who carried the transportation package, Senator Ram Villavalam and Representative Cam Buckner, who were the sponsors in the House and the Senate, for making this pilot program a reality. And in short, the legislation outlined that RTA would be providing the network with 25,000 preloaded Ventra cards at a $20 value each. And then the network distributed these cards to domestic violence and sexual assault programs throughout RTA's service area. We recruited 54 domestic violence and sexual assault agencies to participate over the first year of operation of the program. And the cards are needed to be allocated via the legislation based on previous client volumes for each program that was participating. So we also had to collect some of that data on the front end before we started distribution. Cards were distributed in 2 batches. The first batch was distributed in November of 2023. The second batch was distributed in April of 2024, and distribution was monitored routinely. This allowed us to redistribute cards from lower use agencies to higher use agencies based on client needs and based on the feedback we were getting via the surveys and the live Excel spreadsheets. The network continues to monitor distribution for the remaining cards in 2025. And also, as part of the legislation, the gender-based violence community was also given a seat on the RTA Citizens Advisory Board. This group meets quarterly and allows the representative to the board to provide updates on the program and feedback related to transit issues and to consult on projects. And so our representative is Lauren Gutierrez. Here is her email address for those of you that are interested in providing feedback or hearing more about the Citizens Advisory Board. Lauren is with the Legal Aid Society of MFS. Okay, so program eligibility. Domestic and sexual assault services are really designed to be trauma-informed, one-stop shop, low-barrier environments for survivors who are really vulnerable when coming and receiving and seeking services. And so we know that survivors have a pre-existing relationship with programs and with their contacts within agencies. And they may be unlikely to disclose their full experience of abuse in other settings, but they might feel comfortable doing that with a program that is specifically tailored to address their needs as a survivor. And so keeping that in mind, during our info sessions with participating organizations, the network issued guidance on program eligibility for survivors receiving cards, and we can see some of those eligibility requirements on the right. So identifying as a survivor and expressing financial need to access transportation, which could be facilitated through the RTA options, including CTA, Metra, and PACE. And these guidelines were very intentionally flexible to preserve agency autonomy, maximize the utility of the cards for survivors. And also, this approach really fundamentally trusts survivors to identify their needs and empowers them to make choices to support their safety and well-being. And we know that a lot of times when survivors are in the process of leaving or rebuilding their lives after going through an experience of abuse, we know that a lot of times that autonomy and that empowerment is failing. And so this program is a perfect example of how we can have these eligibility requirements that fundamentally trust survivors. Awesome. So with all of the program background covered, I'm going to hand it over to Shelby to take us through our overview of the program data.
Awesome. Thanks, Maralia. So we collected a few different kinds of data during this process. We'll touch on each of those in this section of the presentation, but we thought we'd start with an overview. So here's a quick peek at those overall distribution statistics from our first year of operation. The first year of operation ran from November of 2023 to October of 2024. And during that time, we distributed 16,668 cards to 4,066 survivors. That's an incredible number. It's 67% of the entire allocation of cards that we received when the program was created. And that meant that we averaged about 4 cards per client and about 50 cards per day, around like 45.6 cards if you want to be technical. We think that distributing 2/3 of all of our cards in that first year demonstrates remarkably high need for transportation resources among survivors. And I think we have evidence that we'll talk about today that really speaks to the powerful impact of addressing that need with this program. First of all, outside of numbers, we really want to elevate that the report also contains provider stories, that qualitative data, which was provided to us through the routine survey process of providers. So again, we have those 54 providers all participating in the program. They were responding to 3 surveys across the course of that first year and prompted to provide us with anonymous client stories that spoke to the impact and the experience of their survivor clients in accessing Venture cards. This qualitative data really illuminates how complex and nuanced transportation impact is on survivors' lives, both how negatively impactful is when that access is absent and how powerful it is when we open that opportunity back up to survivors. The slide here represents one of several stories that are in the report. And if you only have a few minutes today, I would really strongly recommend taking a look at our executive summary for some key statistics takeaways, and then taking a look at these stories. They're very compelling and I think really speak to the impact of the program. When we look at our quantitative data, we have 2 primary forms of that. The first of which is card use data. Now, importantly, we didn't have a way to track actual use of these cards. So we weren't, distributing a card and then following that card as it was used across different platforms and different people. What we did have was intended use data. So what that looked like was when providers were issuing a survivor a card, they would talk with them about their needs and learn a little bit about how the card would be intended to be used. There are 3 categories that we collected intended use data for: who intended to use the card, what transit they intended to use the card for, and what purpose they intended to use the card for. Importantly, folks were only able to indicate one response to these questions. And of course, use cases may have actually been much more multifaceted than a single salient point. So I would really encourage folks as we look at this data to think of these as perhaps the most salient use cases that survivors imagined, but they're not really representative of the full range of scenarios that a survivor might have used a single card for. I also want to name at the top of this section that all of the data that was collected by providers during the distribution process was collected on a voluntary basis. So while we have very, very high response rates across all of our different data points, you will occasionally see a small proportion being unknown or unreported, usually 1 to 3%. And that is because we did make this a voluntary process. Of course, we first and foremost wanted to make sure that survivors were accessing the transportation that they needed, and doing that service delivery in a trauma-informed way so that we weren't requiring data collection at a time where it might have been inappropriate to ask. All of that out of the way, we can take a look at this first pie chart, which looks at those primary intended users of the cards. And what we found was that overwhelmingly the client or the survivor receiving services was primarily the intended user of the card. 83% of the time, the person receiving services was expected to use the card. We do know also that survivors are often heads of their households, responsible for children and dependents who may also rely on them for access to transportation. And with that really flexible eligibility criteria, we wanted to make sure that survivors could support their families and loved ones with these resources as needed. So you'll see that about 14% of cards were intended to be used by a client's children. And about 3% were intended to be used by someone else who lives in the client's household, perhaps a member of their family, like an elderly parent, for example, who might also be reliant on that survivor. We have 2 other pieces of this card use data to look at. The next is the intended transit type. And what we see here is that 3/4 of all of the cards distributed were expected to be used on CTA. Another 13% were expected to be used on Metra and 11% on PACE buses. I think that this is pretty in line with our existing expectations, right? The CTA exists in an incredibly dense population center and has the densest selection of transit modalities as well as stops. So this data really, I think, aligned with our expectations. The last piece of this intended use data comes from the question of how do you intend to use the card? Like, what are you going to be traveling for? And in this case, we saw that in almost equal measure, these cards were primarily being used to access groceries and other daily essentials, or to travel to work and job interviews, which tells us that these cards were really a tool to access essential daily needs and financial empowerment through that work focus. There were lots of other things that folks use these cards for: traveling for school, to access social and legal services, to seek medical care, to go to court, and other items as well. Now we can pivot to our client data, specifically client demographic data. And what I really want to draw our attention to in this section of the overview is that demographic data is always going to reflect the client who received the card. So again, that client is the survivor who's actually receiving services. And even if the intended user of the card was perhaps the client's child or another household member, the demographic data recorded was that of the client, because the client is the survivor who is eligible to participate in the program, and the person who our participating agencies had the most information about to answer these questions. So that kind of is what informed the decision to uniformly collect only client data. Another thing I'll just bring to your attention at the top of this section is that there are some of our providers who are really focused on providing youth services, services to minor children. So we'll remember then that the client is a child. And even if they were issued a card for another household member who perhaps was their parent, only that client's data, the child's data, is recorded here. Similarly, for our orgs that primarily provide services to adults, that adult client's data is reflected here, even if that card went to their child to travel to school, for example. With that out of the way, let's talk a little bit about these numbers. You'll see that overwhelmingly, cards were distributed to clients who identified as female. About 86% of all of the cards were distributed to someone identifying as female. We see about 8% of cards went to someone identifying as male. And then a combination of about 3% of cards went to folks who either identified as transgender or as non-binary or genderqueer. When we look at client age, we really see a full range, anywhere from our minor children to adults of retirement age. But the largest plurality of clients were in their 30s. If we take a look next at our race and ethnicity data, you'll see that the largest proportion of our clients' racial identities was actually Latino, closely followed by folks who identified as Black or African American, and then followed substantially at a smaller proportion were clients who identified as white, that followed by several other racial identities at much smaller proportions as well. The big takeaway as we look at this is that clients were overwhelmingly people of color who were receiving these cards. If we look at client ethnicity, you'll see that about half of clients did not identify as Hispanic and 45% of clients did identify as Hispanic. That relatively closely aligns with the folks who did identify as Latino as their primary race. And what I will name here as well is that we did have, again, a one response policy for race. So folks weren't able to check multiple race boxes if they have a multiracial identity. They were choosing one most salient racial identity. So just a kind of limitation on that data that I want to name for folks is that we were requiring folks to only respond with one racial category. And I'll offer a little context about why that is. Most providers participating in this program report some or all of their client data in an online software called InfoNet, which is a client management software that's available to providers across the state. And in order to make sure that this process was relatively smooth and flexible for integrating into all of our different providers' existing intake processes and client interaction processes, we chose to use categories that were already in InfoNet under the assumption that that is how most of our providers were already collecting information. So all of these categories should reflect what is in that online data management system. And that was sort of what informed our decision to offer these categories as options, recognizing, of course, that they are not perfectly encapsulating everybody's approach to characterizing their racial identity. Next, we can see that we also collected client-dependent information. And this was really interesting because it let us see that 60% of clients were parents, were parenting and therefore responsible not only for their own well-being and their own transportation access, but also that of their children. You'll see here that a little more than 6,500 folks did not have children reported. And then most commonly, family size ranged from about 1 to 3 children. But ultimately, our range went anywhere from 1 child up to 13. And lastly, we can take a peek at this monthly income data, which was really, really striking. We found that 47%, almost half of clients receiving these cards, reported having $0 in income. Importantly, I will raise that this reflects both folks who were actually unemployed and making $0. And it also reflects folks who perhaps were employed, who perhaps were making money, but who did not have access to that money. Again, because we recognize that financial abuse is something that shapes so many survivors' lives. You'll see that we also have several other income categories ranging from less than $500 per month to $500 to $1,000 per month, and then folks who made more than $1,000 in a given month. And what I'll really raise about that other set of categories is that almost all of these fall well under the federal poverty limit, meaning that for a single adult making this income per month, they would be qualified federally as living under the poverty line. And given that many of them, more than half of them, are parenting as well, this would put folks well below the poverty line. And lastly, we do also have some client residency data that's interesting to look at. This is a heat map of roughly the RTA region and the number of cards that were distributed in every zip code where clients reported residency. You'll see that they ranged anywhere from like literally just 1 card being distributed in that zip code up to as many as 1,200 cards being distributed in that zip code. The most dense of these zip codes was 60629 in the heart of the city. And I think this map helps us see not only where distribution was densest, but also that distribution really ranged all the way through the RTA region. And we reached people really across the available like jurisdiction, which is really wonderful to see. A small caveat that we'll offer about this data is that this map does exclude folks who were living outside of the RTA region who reported that as their official residence, but who for some reason or another fled to the RTA region and were temporarily living there and using transit cards. And we excluded those because they weren't where the client was living when they were receiving services, even if that's where they were officially reporting residence. That was a lot of numbers, a lot of information at once. And I think it can be helpful for us to zoom out a little bit and think about that data at a summary level. So what we think this data really demonstrates is that the majority of survivors who were served by this program were parenting women of color with little to no income. And they predominantly lived in Chicago and were taking the CTA. But ultimately, the program spanned across the RTA region and across all of the available modes of transit. These cards very clearly facilitated transportation access to address survivors' everyday needs, as well as creating financial empowerment opportunities by taking so many survivors to work and to school. And lastly, it also demonstrates that supporting the well-being of these survivors also supported the well-being of these families. The folks who were reporting that they were reliant on the survivor to access transportation as well. which I think is such an important reminder for all of us that addressing survivor transportation needs also serves our larger community. We mentioned some alternative models at the top of this presentation, some ways to sort of expand and more creatively think about addressing transportation needs. And that's what we're going to kind of talk about next. So looking a little more aspirationally in this next section of our presentation. In addition to this really rich data that demonstrates who was using our program and how they were using our program and why they were using our program, we also heard from providers that there were clients who could not use our program because it didn't function to meet their needs. We primarily heard this from providers during our surveys, which again were conducted 3 times during the course of the year. First, we found that need was unexpectedly high among our providing agencies, anywhere from 1 to 2/3 of the agencies, depending on the survey. We also found that 1 to 2/3 of our agencies reported that they had clients whose needs could not be met by giving them a venture card. There were also several technical challenges that had arisen in our feedback that we wanted to name, primarily around the cards being a $20 value. So for clients who were really heavily reliant on the program, $20 gets spent down very quickly, which kind of led to this puzzle for providers where they sort of had to guess how many cards to issue a client to get them through until their next appointment. That's an imperfect science, and it was something that was a real challenge for providers to do. And of course, if that was perhaps an underestimation of a client's need and they followed up later to say, hey, I'm in need of some more support, it created a bit of a complex situation where information was provided remotely. And that required, conveying a very long string of numbers over the phone. It was really prone to error. And lastly, we also have to recognize that many of these providers were working with folks who did not even have a phone, right? Folks with $0 in income and who are very vulnerable might not always have remote access to services. And in those cases, clients may have needed to come back more frequently for access to more cards, which then required them to use those resources simply to get more resources, which isn't very efficient. The last sort of technical challenge that did arise in our feedback that we wanted to name is that card values couldn't be combined to make purchases in the Ventra app. And importantly, for the survivors who were using the Metra as their primary mode of transit, encountered an issue where it's much more cost effective to purchase a weekly Metra pass than it is to buy a ticket every day of the week. But that weekly Metro Pass costs more than $20. And you could not pay for one weekly Metro Pass by combining the value of 2 Ventra cards. That required our clients to then make the less efficient purchase, to spend more money on their transportation needs, which doesn't really make good sense. We have several proposals to sort of address some of these concerns. And we'll talk first about the concern that there were swaths of every agency's client base who had transportation needs that could not be met by giving them a venture card. And the first proposal we would have to address that is really looking at our own Safe Rides program. The Illinois Domestic Violence Hotline, which is operated by the network, operates a program called the Safe Rides program. And the way that works is we connect survivors who call the hotline with a transportation need to an Uber Health ride, which allows them to travel to safety. Uber Health is a slightly more confidential version of Uber that allows the hotline to coordinate a ride on behalf of someone else without sharing any of their identifying or payment information. And then to follow along with that ride to make sure that the survivor gets to a safe location. On average, last year, so 2024, each ride transported survivors and their loved ones about 26 miles and cost the hotline about $43 to provide. And you'll see some other great summary stats up here on the slide. In 2024, we provided well over 2,000 rides to just under 3,500 survivors. We traveled more than 58,000 miles in those rides. And I think the reason we point to this program is that there has been, a great expansion of rideshare proliferation in urban and suburban communities. And offering somebody a ride can be a great way to address scenarios where perhaps we're facing inclement weather, where it's not perhaps appropriate or safe to wait outside for a long time for public transit. But also to help folks who perhaps have mobility needs or family needs that demand a car ride over a train ride, for example. It also helps us get folks to places that are not readily on transit lines or even across municipalities, um, and gets them there in a more timely fashion, all of which can be really helpful depending on the exact scenario a survivor is facing. Expanding the funding for this program would likely help to meet some of those unmet needs. And primarily, the biggest limiting factor on the program right now is funding. The next program we would point to is our Survivor Fund. The network operates the Survivor Fund, we have done since 2020. And the primary aim of that program is to provide financial assistance to survivors to both bolster their safety and their economic well-being. This program design, much like the way we structured our program eligibility, really fundamentally trusts the survivor to know and meet their own needs with the tools that are available to them. And year over year, we have found that transportation is one of our 5 most common needs among applicants to the Survivor Fund. We also have really rich survey data that tells us that folks are spending their grant money on transportation. And you can see here that, for example, in 2024, we issued more than 4,000 grants through the Survivor Fund, and about 66% of those applicants identified transportation needs in their application. And then if we look at survey data from some of those applicants, we see that about 43% of survivors spent some or all of their money on transportation needs, which is really wonderful. It's a great way to address those needs in whatever way works best for that survivor. But we also see that 64% of folks who spent on their transportation need continued to need help with it. Because transportation is a fact of life. It's something that often has to happen every single day and costs money. So that sort of recurrent nature of transportation reliance does make it emerge as a really challenging need to meet with a single payment. If we look at these programs together, what we know about them is that they're both already operating in Illinois. They both have successful histories of scaling up quite rapidly in the last few years. And they've demonstrated real efficacy in addressing transportation needs for survivors. So we would propose that expanding the RTA pilot program to also include funding for some of these alternative models would help to reach survivors who are currently excluded from the program because a Ventra card won't meet their transportation needs. And just to kind of offer a little bit of context on like what these survivors might be using rideshare or cash assistance for to address the transportation need, there are so many ways in which we could reach other survivors. You might think of somebody who already owns a car, but who has experienced that transportation and interference and needs to replace or repair damage on their own car, or perhaps just put gas in their own car. We also know that there might be folks who need to purchase a plane ticket or a cross-country train ticket, or even rent a car to travel and stay with family. Recognizing that survivors' transportation needs are varied, and giving them all of the tools that they need to address those needs would be really, really wonderful. And I would think a powerful expansion of the program. So with that, I'll turn things back over to Marlia to talk a little bit about the recommendations that come out of this report.
So our 3 formal recommendations after hearing from programs via the survey and also programs that just reached out directly to us. Our first recommendation is to continue the Regional Transportation Authority Survivor Transportation Program, to no longer have it be a pilot program, but instead have annual disbursements of Ventra passes to the network for distribution amongst service providers in the RTA region. The second recommendation recommendation is to provide 30-day Ventra passes. As we saw in the data that shall be presented on, the average survivor was receiving 4 cards, and that is the approximate monetary value of a monthly pass. And so we know that when survivors need the support with transportation assistance, it's usually for longer periods of time, and would just make more sense monetarily. The other part of this recommendation is to have the option to consolidate monetary values across individual Ventra cards to reduce technical challenges and increase the efficiency of the program. And then finally, Shelby spent some time talking about alternative models, but expanding the program to include funding for some of those alternative models. We know that while the pilot program has been a huge success, it does not address transportation needs for every survivor. And so providing funding for things like the Safe Rides program and survivor fund programs to address transportation needs and reach survivors across the state where the program is currently excluded is our final recommendation. Okay, and with that, we would invite you to stay connected. This is the first report of our annual report series, and I know Amuna dropped a link to download the full report in the chat, but you can also scan the QR code on your screen. We'd also encourage you to sign up for our mailing lists and access our social media toolkit to talk about the impacts of the program and help us in advocating to continue the program. We expect 5 volumes of Measuring Safety to be released in 2025. Again, this was the first one, so we hope that you will join us for future launches as well. And also, we would encourage you to scan this QR code on your screen to support our advocacy. As we covered at the top of the presentation, this pilot program was able to be created and funded through legislative advocacy that we did in Springfield. And so we're hoping to continue that advocacy in 2025 and advocate to pass legislation that aligns with our recommendations in this report. And so we would encourage you to join us in that advocacy, whether it be signing up for our action alerts, sending emails, making calls to your legislators, or if you're already engaged in advocacy and in Springfield or having district meetings, talking to your legislators about this pilot program and the importance of addressing transportation and survivorship. So again, sign up for our policy action alerts. We'll notify you of opportunities to not only advocate for this program and an expansion of it, but also for our other legislative and policy priorities that you can find on our website as well.
Okay, well, I think that has reached the end of our questions. I really appreciate everyone taking the time to be here today. We have our contact information here for anyone who has follow-up questions, Maralia, myself, and Muna, who joined us today. Any closing thoughts you wanted to offer, Maralia?
No, thank you all so much for joining. We look forward to seeing you at the next report launch. Take care, everyone.
Take care.